So my name's Damien Zilm. I'm a GP. I work in a number of areas. So I work in some of the remote areas, Leonora, Laverton, Meekatharra. I am really looking forward to the full rollout of my health record, where I know that as a GP working in any of my clinics, I can pull up the record, I can see where they've been to see other GPs, other practices, and also within the hospital sector. Most importantly, the things that I find hardest is when I've got a new patient to me who's complex, complicated, who has come into the town that I'm working and I don't have access to their information, needing to phone up their other care providers or phone for to the hospitals to try to get discharge summaries, medication lists, trying to talk to GPs or pharmacists, just trying to obtain all the information. It's time consuming and it doesn't provide the best care. The benefit of my health record is I'll be able to go to one place and all the information is going to be there. It'll really simplify my management and really make a difference for the patients that I'm looking after. I will have access to the information I need for my patients. Most importantly, that's past medical history, and especially it's going to be medications. I'm going to know a lot more about my patients because I'll have their information. I'll also, really importantly, have access to their pathology and X-ray results. It is especially important for patients living in rural and remote. So patients that live within the community that I'm looking after, nice and easy, all of their records are on my file or in the file of the surgery. Now soon if I see people that have come from other communities, such as Leonora, Laverton, if they've come down from the lands, that's where they're normally being looked after, but it's normal that these patients will come into the towns that I'm working in, and being able to get ready access to that information from their GPs so I can continue that management, but more importantly as well, I can then upload what I've done so their GP actually knows what I've done, so there's a proper continuity of care for the patients. Patients that are living in rural and remote areas will be looked after by the regional centres, such as Kalgoorlie, Geraldton, and also through Perth. And getting that information is not always so easy, whereas having that information which has been uploaded onto my health record will really make a difference for them.